Hi everybody, I'm Dr. John Douillard and welcome to LifeSpa.com, where we prove the ancient medical wisdom of Ayurveda with modern science. And today I want to talk about sort of an epidemic that's happening in our culture, which is high levels of cholesterol. I have patient after patient that comes to me and tells me that they go to the doctor, they get their cholesterol checked, and now they're high. And the doctor wants to put them on a statin. And they have heard that they shouldn't go on a statin. So they go online and they start reading about statins. They read about all the side effects. They read about the fact that LDL cholesterol is actually okay at high levels. It's not an independent risk factor for heart disease. So now the doctor wants to put them on a statin that can cause all these problems, and they don't know what to do. So I wrote a pretty comprehensive article, step by step, of what folks can do to get some logical kind of things that they can do, questions they can ask their cardiologist, and navigate through this really crazy maze of trying to understand cholesterol levels. Now, if you're watching this on YouTube or any other platform, please subscribe to our channel. If you're watching on my website at LifeSpa.com, please also sign up for our newsletter so you get this information on a regular basis, and check out our Ayurvedic store on the way out. All right, so let's dig in here. First of all, the side effects of statins, they are real. They affect 1 to 7% of the population. So it's not a ton of people, but considering the number of people who take statins, it's a significant number of people. Things like, liver enzymes going up, muscle soreness or pain, raising your blood sugar levels, affecting your cognitive function down the road. Things like cataracts and other things are linked to the side effects of statins. Now, there are options these days to lower your cholesterol levels that aren't statins that you should ask your doctor about. There's benzenoic acid, there's PCSK9 inhibitors, there's ezetimibe, and then of course there's all the statins. So there's other things that you can look at and ask your doctor about if you don't want to go on a statin. Now the big question is, what if my LDL levels are high? Is that really bad for me? Most people know that the cholesterol level, the actual cholesterol number, is not an independent risk factor for heart disease, and therefore that doesn't really mean that much. But if your triglycerides are high and your LDL levels are high, there are definite studies to show that can increase your risk of heart disease. But most of those studies are with folks eating the standard American diet. So now it starts to get into the weeds a little bit. Here we go. If you are eating a standard American diet and you have high cholesterol, well, then you may, need to either go on the statin or change your diet. You're not going to get away with this by just eating the same food and not going on a statin. That's probably not going to end well. Now, many of my patients, though, are pretty health conscious, and they go to the doctor and they have higher cholesterol levels, not super high, but they already eat a really clean diet. They're already doing really well. So the next question for those folks is to do more testing and find out what your actual risk for heart disease or atherosclerotic plaque in your arteries really is. And there are tests for that. There's blood tests and there's other screening tests that you can take before you kind of jump to a conclusion that this is the end of my life and this is a major problem. There's many things you can kind of resolve. Now, and there is a time and a place for a statin. There's definitely a time and a place for lowering your LDL cholesterol and getting those into the normal range, particularly if you have a positive finding on, say, a calcium score test, which is a CAT scan of your heart, and they look for the amount of calcium plaque in your coronary arteries. And if you have a high amount of coronary plaque in your arteries, well, then you have heart disease. That is what's called heart disease, which means that even if you are eating really healthy and you exercise every day, and your numbers are now high, your LDL levels or triglyceride levels are really high, then that would be an indicator that you probably need to do something, whether it be a statin or some of the alternatives, to get those numbers down, right? That's important. Now, there's another test you can take, which is called the CIMT test, which is a carotid intima media test, which is measuring with an ultrasound your carotid arteries, and they can actually determine what kind of plaque you have in your arteries. So here's where we kind of dive a little deeper into the weeds. the calcium score from a CAT scan, which you can go into pretty much any imaging center and just get it done for $100, and they'll give you that calcium score. You can share that with your cardiologist. More and more cardiologists are recommending getting a calcium score. 20 years ago, no one ever did that. But now the radiation levels are significantly lower. It's a really good screening test, but it tells you about your calcium plaque, which is hard plaque, which is generally stable plaque. But if you come out of that test and you have 0 plaque in your arteries, 0 calcium plaque, that's a really good indicator that you're a little bit of higher cholesterol could easily be managed by probably something like diet or lifestyle, or maybe some alternative herbs or supplements, things like that. But if those numbers are really high and you have the plaque in your arteries already, then I would probably, look to do things more aggressively, right? But that doesn't tell you if you have soft plaque or not. Soft plaque is actually the more dangerous plaque from the point of view of a stroke. A soft plaque will break off or can break off or more likely to break off and actually cause a stroke than the hard plaque, which is more stable. The problem with hard plaque is it can slowly occlude the artery until it's completely occluded, and that's a heart attack. So that's where the danger of hard plaque or the calcium plaque is. So the CIMT test will actually measure some of your hard plaque. It'll show you where that is, but it'll also measure your soft plaque. And that shows you risk of stroke and things like that. And that is also a test you can get locally. You don't even need a medical doctor to go in and recommend it for you. You can go in to a CIMT center and get that done. This is different than just the regular ultrasound of your carotids, which is usually a $75 test. And they look at, again, hard plaque. They really can't tell the soft plaque. It's the CIMT test that gives you the information about the soft plaque. The next test, other than the test that they're going to give you at the cardiologist's office, right? They usually do a nuclear stress test and an echocardiogram and all these kind of things to also determine the function of your heart. All really important tests. But sometimes those tests don't tell you how much plaque do I have, how open are my arteries, and that's where these tests will help you find that out. If you do have some of those concerns, the next test, which would be more of a elaborate test recommended by your doctor that you could ask your doctor for, is something called the Cleary test, CLEERY test. And this is where they actually inject a little bit of dye, and then they do into your arteries, and then they do a CAT scan where they look at they have a computer imaging where they look and see, okay, what is really happening in your arteries, how much plaque, how much hard plaque, this is all in your heart, how much soft plaque, and they can really get, dial in the details of what's going on in your heart. And that's another test that's probably not covered. These tests are probably not covered by insurance, but they are really good screening tests. So and they're not expensive. So God, I got this much plaque, not really much to worry about. I got to change my diet, that kind of thing. The other thing to do is get some more blood work. Blood work's really important. There's a test called the ApoB test, which is a specific type of the LDL cholesterol. And that's the one is sort of the test for your cardiovascular risk. And you really want that number to be on the low end of normal, not the high end of normal. Another test you should get once in your life is called the Lp(a) test, which is a test that measures your genetic predisposition to heart disease. And that number, of course, if it's lower, the better for you. That's also really important. And then also there's something called the LDLP test, which is the LDL particle test, which gives you information about the size of your LDL particles. Are they big and fluffy, which are healthy, or are they small and more penetrating into your arterial lining and therefore more dangerous? So those are the things that you would do to kind of go, okay, how much risk am I at with this now high cholesterol level, high LDL level? Let's say you have a high triglyceride level and maybe even a low HDL level. All those would maybe indicate that you might be under some risk. Get these tests done, and now you have a better sense of what the risk might be. Other things now, when you go down the lifestyle road, like what do I have to do for my lifestyle? Diet, exercise, routine. All these things really do matter. And I've talked about diet and lifestyle in many other videos at LifeSpa.com, so you can go there for that. But there are a couple of deficiencies that I mentioned in the article associated with this video, and deficiencies like vitamin D can also put you at risk for cardiovascular disease. You want to keep your levels between 50 to 80 nanograms per milliliter. Your vitamin K2 is a matrix protein that takes the plaque, the calcium, and drives it to your bones, supports bone health, and keeps that calcium from building up in your arteries. Magnesium, also shown to be one of the heart healthy minerals for heart function and heart health. And then also vitamin B12, which is also a very chronic deficiency, usually associated with homocysteine levels, which are high, which is a very powerful inflammatory marker, also linked to heart disease. So make sure those numbers are good. Read the full article, get all this detail so you can kind of navigate this crazy road around your visit to your doctor where they told you your cholesterol levels were high, and now you're going to see a cardiologist to kind of dig in deeper. Hopefully these are just questions that you can ask your cardiologist, and they can then recommend some of these tests for you, and you can dial in a much more logical and rational approach to your cardiovascular risk. Hi everybody, I just want to take a minute and tell you what we do here at LifeSpa.com. You know, I've been in practice now for 40 years, 38 of them have been practicing Ayurvedic medicine full-time. For the last 20 years, I've been writing articles and doing videos on the ancient medical wisdom of Ayurveda with the modern science. You know, if something's been around for 1,000 years, still practiced today, and you have modern science to prove it, well, I really feel like that's something we should all be taking a look at. And that's what we do at LifeSpa.com, and all that information is for free. So just go to LifeSpa.com and search in your health topic, and you'll get the information, the article that you need, hopefully that will help you. While you're there, check out our Ayurvedic store. You can get there through LifeSpa.com or go to store.lifespa.com. And there we have all of our organic Ayurvedic herbs, organic skincare line, more books, tapes, knowledge that we give you is all there at our store. All of our cleansing kits are there in our store. All of our herbs are whole herbs with the natural occurring microbiome, the way it came out of the soil. And that's critically important, because if I took the bugs out of you, you'd be completely different. We take the bugs away from a plant, like sterilizing and making an extract or spraying your food with pesticides, you lose significant benefit of that plant. And that's why we use the whole plant with the natural occurring microbiome. So check us out, learn more about what we're doing here at LifeSpa.com, and we'll see you again.
This recording is brought to you by LifeSpa, where ancient Ayurvedic wisdom meets modern science. Get access to free health video newsletters by Dr. John at LifeSpa.com. These statements have not been evaluated by the FDA. These products are not intended to diagnose, treat, cure, or prevent any disease.